Namaskar. Welcome to this panel discussion on telemedicine, the current practice and future prospects in India. So we have Dr. Bhargavi Chatterjee Bhattacharya, Dr. Arnold Paul. Let's straight away get into the discussions and we'll see how much we can gain from each of you. So I'll start with Dr. Bhargavi. You can first give a short, brief introduction of yourself and then say exactly, what would you like to discuss over the next hour or so?
Oh.
Over to you, Bhargavi.
Okay, thank you. Thank you very much. I'm very happy to be a part of this panel today. It's a privilege to be here. We have experts on this side of the screen and also some eminent audience on the other side of the screen. Now, briefly, just to tell you a little bit about myself, I'm Dr. Bhargavi Chatterjee Bhattacharya. I'm a consultant psychiatrist practicing in Kolkata, and I'm attached to Nightingale Hospital and Southeastern Railways. And to give you my background so that you can see it in perspective, I did my MBBS from Medical College, Calcutta, and then I did my psychiatric training in England. I'm a member of the Royal College of Psychiatrists. Actually, I'm in their honor roll because I was awarded the Maurice Marquis Public Education Prize. I have always tried to do my bit to promote psychiatry. I never look at it from a very narrow angle. Treatment and management represents a very small part of the total picture. So, for example, health promotion strategies, they're all inbuilt and they form a chunk of psychiatry. I've done several presentations in televisions, radios. I've done conferences. I've written in magazines, web magazines, newspapers, basically to promote psychiatry. And now I feel telepsychiatry is the way forward. It helps to bring psychiatry to the patient and it bypasses a lot of issues, a lot of accessibility issues. And that's why I feel that telepsychiatry has the power of transforming psychiatry. I'm excited to be a part of that. Over to you.
Thank you, Bhargavi. It's nice to know about you and definitely will listen to what you share with us. We have another eminent panelist, Dr. Arnold Paul. He is the other panelist of this session. So please introduce yourself and let's hear your opening remarks. Arnold.
Hello, first of all, thanks for having me here. I'm really glad to be here and feel honored and privileged. My journey as a healthcare professional has been very interesting. I'm a trained biochemistry professional. I have 2 degrees from US, a master's from Virginia State, and a PhD in biochemistry from American University, Washington, DC. I worked in the diagnostic industry for like last 10 years. Then I moved into health IT sometime around 2012, and then I found my Patient Planet. It's a home care company. Core competency lies in home care, and then I'm also part of WHO roster of expert member and president of Government Blockchain Association Kolkata and regional chair of Fibre India. And currently I'm also part of a review board member and HIMSS USA mentor for 2020-21. So that pretty much sums about myself, and I hope today's talk will be a very enlightening, and this deliberation will be very helpful to us. Thank you.
Thank you, Arnold. I'll come back to Dr. Bhargavi. So would you like to share? You said telepsychiatry is definitely one of the most promising areas of telemedicine or telehealth. And the other area where we have had a lot of success is really radiology, teleradiology. So we'll come back to you. So what has been your experience in telepsychiatry overall? I mean, you have had your experience abroad as well, but if you can say with particular focus to India, that would be great. Over to you, Dr. Bhargavi.
Right, right. Actually, as I said, accessibility, I mean, there telepsychiatry has a lot to offer, but still we are facing challenges with acceptability. Now, here I can see a very clear divide. There are the digital natives and the digital immigrants. The natives are very open about it. In fact, they prefer online consultation. They are aware that online consultation has a lot of advantages. The problem is with the digital natives. They want it to be the old fashioned way. They want to see a real doctor, I mean, in flesh and blood, and they want all the experience. Now, what is happening in this coronavirus epidemic is that they are unhappy even with the offline consultations, because they come and they take away the masks, and I have to focus on their masks rather than on their problems. And if I'm distracted, I can't concentrate on the problem. But this is a major issue. People in their 70s, they come, they take off their masks, and they are just not understanding that they are a risk to themselves. And well, I may well be an asymptomatic carrier. So in that case, I am a risk to themselves. So they just don't understand this. But they are also complaining that the time is too short, and because I'm in protective gear when I'm doing offline consultation, they complain that we can't recognize you. Now, this some of these problems are specific to this corona epidemic. Some of these problems will persist. For example, especially with the elderly people, I have to see patients who are bedbound, patients who are incapacitated, who cannot physically come to my chamber. In that case, if I can access their documents beforehand, their reports and all that, and if I have a file, I can access it before, and then it's much easier for me to assess them. So online consultation that way offers a very clear advantage. But I guess this would have been a problem with everybody. I mean, I was just reading up the other day, Socrates, the wisest man of Greece. He was very much against reading and writing things down. He felt that things should be committed to memory. Fortunately, his disciple Plato, the next generation, thought otherwise, and he wrote down. And so that's why even now, when we read books to broaden our horizon, we know about Socrates, and some of his techniques, Socratic questioning, is still very much alive and used by us these days. But it's always a problem. It's the senior generation, the elderly people, they are very, very reluctant to embrace something new, and they have to grow. I mean, I similarly experienced a problem when I was younger, because the concept of a doctor, just as they have a concept of consultation should be in flesh and blood and not online, similarly, they had a concept that the doctor has to be male with heavy rimmed spectacles, preferably balding, etc. But at that time, working my way through had been a challenge. Trying to explain to them that, look, these are superfluous. Basically, you need to have the skills, you need to know what the problem is and manage the case accordingly, and I can do that. Right now, can see a parallel with telepsychiatry and offline consultation. People have this concept of telepsychiatry, of consultation, and that has to be broken. And I think one of my patients said very clearly, "Mujhe ilaj chahiye." He's from Bihar. He cannot come because there are no trains, and he realizes that the other things are superficial. He wants "Mujhe ilaj chahiye." He wants treatment, and this is the way to go. There are lots of other issues. For example, one of my patients felt very traumatized about coming to the chamber, waiting in the waiting room with other patients, and she could never properly open up. With telepsychiatry, I'm seeing her in her bedroom when she's relaxed, with her family surrounding her, and she can communicate much more freely. She opens up to suggestions, and she's accepts the treatment modalities much more easily. And also there are certain things that I would like to show you. For example, sleep diary. All patients say that they don't sleep well. Where exactly is the problem? I tried it offline, told them that they need to have a sleep diary, but it doesn't work. So what I have done is that I have shown them something like this. I've written the dates, the time he went to bed, and when he fell asleep. I could see that for this patient, this the gap between these two periods is 4 hours. So basically, he was lying in bed for 4 hours. So I could focus on that and then discuss this and take steps appropriately. Similarly, with this diary, alcohol and smoking diary. Specifically, when addicts come, they don't know what their alcohol intake had been over the last weeks, what their smoking intake has been. This also worked because they have got a pro forma, so they just have to fill it in. And so this works well. The other thing is some people have unrealistic expectations about studies. So this is what I did. These are small chunks of information. I mean, patients can't have concentration for reading more than a page. So these are small bite-sized information. I enclose them as attachment in WhatsApp, and then patients can follow this. I mean, this broadens the horizon rather than just medication. If I can incorporate these elements in treatment, then the treatment becomes holistic, and it's much acceptable to the patient, and it's better for all concerned. Uh, I have positive experiences as well. For example, some of my patients said it's like a doctor has come to my room because I can see him in his familiar surroundings. Patients have shown me, I mean, their house around. Look, these are my birds. These are the photographs. This is my room. These are my plants. So that is a very rewarding experience. So overall, there are challenges, and also for many of our patients come from outskirts. For them, coming is a major issue. They have to book a car, get 4 persons because the person is not willing to come, then go through the entire period, wait. I mean, it's very disruptive. The financial cost is huge, the social cost is huge, and obviously what happens is that patients fall through the net because psychiatry should be accessible to whoever wants it, and remote parts of the country needs it the most. That is where the bulk of the population lies. That is where the bulk of the problem lies. Accessibility has been an issue regarding broadband connection, but that has improved. I mean, there had been issues, there had been glitches, but more or less we have been able to cope with it. I mean, some way work around it. But I do feel that telepsychiatry is the way forward, and if we embrace it, we will get a lot of benefits out of it.
Yes, I think it's very nice to hear of your positive outlook. But you have talked about quite a few challenges, and some of those are technological ones. So, Arnold, how do you really overcome the technological barriers? Of course, the mindset barriers, other things will come to later, but I think technology, because I think bandwidth, the accessibility issue, that's a real pain in our country.
That's
Your views, Arnold?
Right. So coming to your technological barriers that you can think of, let me play a devil's advocate. I mean, we see a lot of companies, entities offering 5Gs or 4Gs and upcoming 5Gs. But the real problem is this: when you are trying to upload any documents and things like that, especially the radiological images and all, especially in the rural areas. So I have an interesting anecdote to share. When we started our patient panel, home care company, before that, the reason behind was we had signed a MOU with IIT Ropar to provide telemedicine services to the people of the rural areas in Punjab. So we served more than 12,000 patients there, and in 3 days, within 3 days, there was no show, suddenly. So we thought, what's going wrong with our, service? So then we volunteered, and we came to know that, someone came up and said, if you're not providing them the whole 360-degree service, they need to go to people, places like pharmacies and things like that, not just the consultation part. You know, when we started off with this telemedicine, people thought it's only that, teleconsultation and all, but we need to provide all kinds of services that goes along with telemedicine. That's the telehealth that we're looking for. So when you're trying to incorporate these devices and wearables, uh, the bandwidth would play a major role, because just a telehealth consultation won't do, telemedicine consultation won't do. You would need a 360-degree approach to it. As Dr. Bhargavi said, we need a holistic approach to this whole idea of telemedicine. So once we have these all kinds of, later on, maybe we'll be having this Internet of Medical Things and other wearable devices. So, and then bandwidth would play a major role. If you don't have a good bandwidth, and currently, I would say this telemedicine guideline that was issued sometime in March 2020, it's a game changer, no doubt about that. There are certain areas where it's a little sketchy, but overall it's really good. It's a boon in a way during COVID times. I think we are, in a good position to take it forward. So yeah, apart from the bandwidth issues and things like that, I don't see much of a problem. And I see lot many companies working in these wearable devices. Maybe they will need a lot of good bandwidth and other equipments. But then again, we need to take care of the cost that comes with it, because you don't want the cost to escalate. So yeah, the challenge would be containing the cost also, if we were to give good services. But the interesting thing is, uh, patients have now become the participant in the decision-making process. Unlike earlier times when people were, very reticent, when they go to a good doctor, they would hardly speak. They would carry someone with them, as some elder. Now they are very open, especially when it comes to psychiatric disorders and maybe some venereal diseases and skin problems. So this is some of the areas or domains, I would say, that telemedicine is going to come in a big way. Yeah.
We'll come back to Dr. Bhargavi. So, what has been the experience of your patients? I mean, you would like to share some anecdotes, or what is the patient satisfaction level, or what are the suggestions that the patients, the users provide, that we can really improve the telemedicine services much better?
I mean, it's very difficult to please the elderly people because they have visual problems and hearing problems, and this concept is novel because they are very set in their ways. They find it very difficult to interact via teleconference. So I mean, when I see an elderly woman or an elderly man, they are very reluctant to engage in this fashion. But then that is one of the main problems. But uh, younger people, they prefer this mode of consultation. For example, there's a lot of stigma coming to see a psychiatrist, and the whole process is very tiresome. I mean, booking the appointment. I mean, the phone lines are always busy. Then you get a time. I mean, it's much more convenient with telepsychiatry. I mean, it's very direct. Uh, I mean, some people get very upset about how they would pay my fee, and but I've explained to them that it's not that difficult. So they have cooperated, and this has never been an issue. I think people do worry whether they should pay first and see me later, or vice versa, and I'm quite open about it. But this is a simple thing which seems to be bugging people. But to make full use of telepsychiatry, the other things that matters, for example, I can send them links because you do get a lot of information. Some of them are good information, some of them are bad information. When I send them links to good information, they can read it up and enrich themselves rather than going up to Google sites and doing their own research, because uh, that is likely to be biased, and sometimes biased in major ways. Oh.
So are you also using, I mean, those peer groups for this, some discussion forums, group discussions like that? Are you using those methods also for your teleconsultations or your patients who are of similar disorders?
I mean, webinars, I mean, there are webinars in a big way. Undoubtedly, I'm using that. And as you're aware that we have to update ourselves constantly, and Coursera, EDX, these are platforms where you can learn. So yes, I make it a point that every day for half an hour at least, I study. And that is how I begin my day. Actually, intellectual deliberation is a very positive way of staying well during the epidemic, because obviously, as several of my friends are doctors, the news which we are getting, basically it's a syndemic. It's not just the corona pandemic, it's a syndemic with infodemic, and the mental health epidemic is actually a major issue. I can't give you the figures because of confidential reasons, but specifically after the suicide of Sushant Singh Rajput, I mean, hell has broken loose. It's a very difficult time, and unless people are open to new ideas, unless people are willing to grow, they will fall through the net, and it can be a very worrying situation.
No, like there are various self-help groups. I mean, physical, I mean, contact groups as well as on the social media. I mean, in Facebook itself, there are various like that. So in India, is that a common thing, or you don't have any groups like that in your patients here in India?
Self-help groups, there's only one group which I mean, but it's an offline group. It's not an online group. This is a very unfortunate group of people who have lost their only child. I mean, by accident or whatever. They have a group because they find it very difficult to integrate back into the society. So, I mean, they have contacts with themselves. I mean, they talk to each other because other people don't understand their misery. And I mean,
Right.
it's very difficult when other people say that my son is doing this, my daughter is doing this, and uh, they find it very hard to cope. So they talk to like-minded people, and then gradually, once they are comfortable, they integrate back into the society. I mean, everything, doing puja shopping, going to restaurants, everything for them is a challenge. I think it should be extended online. But this is a very good self-help group that exists.
So I'll come back to Arnav on this because I think technological now this online discussion forums are very much possible, and we see in many countries, many developed countries, European, American countries, they do have a lot of such groups. I mean, are we thinking of building such communities in India? You think it's possible in the near future?
Uh, it's very much possible, and I believe it should be done. And I don't see like patient forums like you have this some 23 genes, something like that, in US, where they keep all the data, other records, health records, and they form a group. People having similar kind of problems, health problems. I don't see much of. Maybe there could be many groups though, but I don't see many popular groups. And so, and then we have so many apps. There'll be like 175 health apps, but the user traction is not there. Like if I may say, like Fitbit, it's a very popular thing, but the novelty wears off. Similarly, I know you need uh, some kind of thing that actually there's a traction, there's a sustainability of that particular project or a group or a forum. So we need all the stakeholders to get involved in this, maybe the government side, the practitioner, providers, and civil society. We need a lot of people from the civil society, from the patient community. I think patients need a voice. We need to empower them, and then they all come together and form a group. I think that would be ideal situation, you know.
The
And
theme of this panel
considering
discussion,
what
yeah.
we are having now,
Carry on,
yeah,
please carry on.
Yeah, so currently we are going through this phase of telehealth 1.0, I would say. I'm much excited about the future when it's telehealth 2.0 or 3.0, where we have a lot of internet of medical things, a lot of sensors, and we need a lot of blockchain would be a great facilitator as a tech, because it will help in the data provenance aspect of it and credentializing physicians, because when you have so many providers or aggregators in the healthcare system, in the ecosystem, a lot of people, maybe you need to get people who are adequately qualified to do that. So they would help as a gatekeeper. So blockchain technology would really help in the data provenance part and credentializing of physicians. So tech will play a big role, and I think peacetime is the right time to prepare for war, as they say. And I think this is part of that moment. And maybe in a year or two, we will totally disrupt this thing. Telehealth probably will have a lot many things to offer.
Yeah, actually, that was what I was trying to point to. The theme of this particular panel discussion is not just current practice, but also future prospects. I mean, we have the industry 4.0, and
Right.
people are saying we should have healthcare 4.0. It's not 1 dot or 2 dot. So if we really need to go to healthcare 4.0, and in fact, digital health will have a huge role to play. So how do
Right.
you look at it? I mean, what do you think? I mean, how are we going to advance? Of course, we still have connectivity, accessibility issues are very much there. And as you rightly said, cost is another factor which have to be taken into account. But how do we look at it? I mean, how do we think India would move towards that healthcare 4.0?
Could you repeat that, sir?
Healthcare 4.0, how do you think India can move towards it? I mean, what is your version of your roadmap, or maybe ideal situation? Maybe we may not be able to live up to that timeline as we think, but at least when do you think what is going to happen so that we actually bring in digital health in a real full way, as you rightly said, 360-degree services?
Right, right. See, it would grow organically also. That's a big thing. You can't push, and there's a limit to the push you can do, and there will be organic growth, as well as you will see a lot of innovative things happening in healthcare space for sure. And we are looking for, I mean, telehealth will cater to this remote monitoring patients who need this remote monitoring, especially post-operative care and things like that. People who are going through that phase, especially in home care sector. I would believe we can foresee a lot of exciting times, but we can't really predict what's going to happen. Timeline wise, I would say 2 to 3 years, we would see a lot of disruptions happening in this space, because everyone is coming up, becoming aggregator. If you Google, you will see a lot many aggregators getting into the space, offering providers offering telehealth as well as aggregators offering telehealth. I know self-help, lot many things happening in the same space, and too many players. So you need to filter them out, and so only the serious players, serious enablers would sustain. Will have a sustainable model, because it's serious business. Healthcare has a zero, policy for any mishap happening, unlike other domains. So I believe you will have serious players who have this domain expertise in AI. I had a question to put to the panel, because when I read this health guidance 2020 March 23, I read somewhere that you can't have this AI capability, something like that. The providers
Yeah,
can't have this. So I was just wondering, why limit the scope of it? I mean, we are
yeah,
just blossoming. It's just time to grow. I don't know. I mean, that's why I was asking.
yeah. I think yeah, that's a
It
very
becomes a
pertinent
regular.
question. Yeah. That's a very pertinent question.
Yeah, it
Telemedicine
becomes a
practice
regular.
guidelines, even they have kept a lot of exclusion criteria, so to say. Even technology standards, they have said we
Right,
are not going
right,
to talk about it. So these things are going to evolve. I mean, but it's a good start, as you rightly said. It's a good start, and certainly it will evolve, because there are also lots of ethical and legal issues which are coming up. And in fact,
right.
like Dr. Bhargavi said about this sensational case in Bollywood, that has also brought in this
Mhm.
particular telemedicine practice guideline, which was duly notified in the Gazette of India on 14th of May. So that has also been brought
Right.
into an FIR. So, I mean, there are lots of issues to be sorted out. Certainly, I mean, things will happen and it will evolve. We'll see what other things going to happen. And maybe it will be after some time we can have another panel discussion on that. I'll come back to Dr. Bhargavi. What is your take? How do you envisage the future prospects with the experience that you have had so far and with the knowledge that you are gathering from all over the world? Because this COVID-19 pandemic has been called as the chief transformation officer. Globally, it has brought in the digital disruption in a way which no one ever could have imagined. So like you're saying timeline, it has actually probably pushed the timeline by at least a decade. So that's the plus point of it. So over to you, Bhargavi.
For example, in Estonia, I think 99% of their prescriptions are online. They have adopted digital healthcare in a big way. In NHS also, for example, specifically for psychiatry, there are websites, True Colors, where you can monitor your mood regularly, where you can see that, right, you're going for a relapse and take steps accordingly. So these are all sorts of things. NHS has incorporated them. The trouble, I think, with India is that it's a huge country, and definitely healthcare is not uniform. There's the private healthcare and there's the public health care, and the private healthcare responds very much to demands of the population. So unless there is demand for telepsychiatry, which is one of the main reasons why I wanted to do this webinar. I wanted people to know that it's a valid option. It's not just a supplement to offline consultation. It's consultation in its own right. Unless there is a demand from the public, the private healthcare sector is unlikely to grow. The government healthcare sector, they have their own agenda set by, people like you, in consultation with WHO and the state government, etc. But I, being a private psychiatrist, I can only see the other end of the spectrum. And the surprising bit is many people feel that poor people go to government hospitals and rich people come to us. That is not the case. Some of my patients who come to visit me, they are extremely poor. And they know that unless they come for treatment, they just cannot survive. For example, if the only breadwinner has a mental health issue, unless that is treated, the family will starve. So even though it's expensive, they do know that expensive things are cheaper in the long run. So they have to come, basically. And this is unfortunately one of the areas why women's mental health issues are ignored, because people can cope if wife is not cooking, not doing the housework properly. It affects the children. If the woman at home is not functional, it affects the children. But that is tomorrow. Today, if the breadwinner is not working, then we can't feed the family. So yes, unless there is demand from that section of the community, it's difficult for telemedicine, telepsychiatry specifically, to survive and grow. But I'm hoping that would happen. I'm sincerely hoping that would happen, because that is the way forward.
Yeah, you rightly talked about Estonia. That is definitely poised to be the first country to have a full electronic health record from birth to death of all its citizens. And of course, many countries are following. Yeah, India has got a scale problem. Our population is just too huge. Most of the Indian states are bigger than most of the European countries. So that size is definitely an issue. But definitely we'll be going there, and we are on our journey, and I think we are doing it the right way. So before we wind up, I think I'll also ask you for your closing comments. If you can say 2-3 minutes about what is your view about where are we really heading towards. So telehealth, how far we have come, what has been the acceptability so far, and how is it likely to increase? It's definitely going to increase, no doubt about it. The change is irreversible. So what are your final thoughts on it, Dr. Bhargavi?
I think once people experience it, then they can see the benefits of it. Otherwise, we do have lots of stigma. This is not the right way of doing things. So as I showed the parallel between, they had difficulty accepting me because I don't fit their classic model of a doctor. I mean, a doctor has to be male, has to be, middle-aged or even elderly. So it had been a journey, it had been a challenge, but the rewards had been, well worth the challenge. Similarly with telepsychiatry, unless they experience it, unless they feel the benefits, and then by word of mouth it grows. Yeah. If they have a positive experience, then by word of mouth it grows. Because some people who have seen me online, they don't want to come back offline. But there are some people who are insisting on offline consultations, and they are totally unaware of the risks of the coronavirus epidemic. And obviously, they just don't realize that unless the doctor is relaxed, if I spend all my energy thinking about the patient's mask and what risks are there to my health and his health, I cannot focus on their problem. I think my patient who summed it up well is Mujhe ilaj chahiye. He wanted treatment, and the logistics, how it is delivered, that is superfluous. And if that is evolving to grow, in order to grow, we need to embrace change.
It's over to you, Arnold. Now, what are your closing comments?
We are at exciting times. Healthcare is at inflection point, I would say. And believe me, but healthcare is different. As I said earlier, it's not like you call a Uber driver, like you can call up a doctor, the first available doctor. There's a different kind of parameters you use when you call up a doctor or want to have an appointment with him. So it's different. Now coming back to this healthcare business, I would say, this is going to be huge in the near future, but it's not going to, be I would say, it can't actually help in any other aspect apart from the healthcare business. So what I'm trying to imply here is you have healthcare and you have other domains, right? Okay, so this is different, but remote patient monitoring is going to be huge later on. And so home care business and people who are suffering from post-operative care would be a big issue, business. But there's nothing that can beat a bedside manners of a doctor, if I may say so. So people would need that aspect of it. And this will go parallel, this telehealth business as well as traditional way of healthcare delivery mechanism. These both will go parallel and will coexist. It won't disappear, it won't change, but it will be a great facilitator, no doubt about that. And once we have all the tech things, it will become more of a 360-degree enabler for providing a holistic, medicinal approach to this. So I would say, once we come to that, it's going to be really great.
So thank you very much, Dr. Bhargav and Dr. Arnav. It's really been a great learning experience for me, and I'm sure all of you have also enjoyed the interactions. So we hope to catch up again sometime later when things move further and we get a lot of things. So thanks to all of you again.
For more updates from CXO TV, please like and subscribe to our channel.